6 inches tall. My name's Tom Carlstrom. I'm a neurosurgeon here in Des Moines, a retired now neurosurgeon, and I'm a friend of Gare's, and I've talked to Steve about his daughter, about the seizure problem she has, and I'm somewhat of an unlikely person to be testifying about legalization of marijuana. I've never smoked it. I have no idea what it's like. I never will, I'm sure. And I'm not interested in any of the recreational effects of marijuana, but there are some things that I think that we need to acknowledge when we're talking about the legalization of marijuana for medical purposes. First off, it does work. It is absolutely a good drug for anorexia, lack of appetite, nausea, vomiting. As a physician taking care of patients, operating on patients, and then having them vomit after surgery, a very, very common occurrence. We run through the gamut of all the possible drugs that we have, and I'd say half the time, third of the time, they don't work. And so it is a known fact that marijuana will help with seizure control when all the others don't. So that's a very well-known and well accepted fact about the medical effects of marijuana. It's also effective in a number of other things, probably for sure, glaucoma, spasticity from multiple sclerosis, and trauma. Those are relatively certain positive effects, and I'm here mostly because I take care of seizure patients. I've done that for 40 years. I don't really treat epilepsy. The neurologists do that, but I certainly get involved in treating epilepsy, and I used to actually treat it pretty much on my own with my patients. That was when we could use a couple of drugs that work pretty well, and I would prescribe those for my long-term epilepsy patients. But now there are, I don't know how many drugs out there that treat epilepsy. Unfortunately, for some patients, they don't work. And as you heard from Sally Gare, there are some patients on multiple anticonvulsants that are still having seizures. And so I thought maybe I'd like to spend just a couple of minutes. She mentioned Sanjay Gupta. There's also, if you're interested, you should Google Dravet syndrome, D-R-A-V-E-T, and watch some of the YouTubes. Actually, don't Google, go to YouTube and watch some of the information on Dravet syndrome as marijuana affects these people with severe seizure disorders. So what is a seizure? A seizure is an uncontrolled electrical activity in the brain. The brain just goes nuts and doesn't do anything it's supposed to do. I would imagine most people here have seen seizures. If you haven't, you probably know someone who's had seizures, and I'm sure there are some people here, aside from these three folks over here, who have seen people who have multiple seizures. So what happens with a seizure? Well, the brain just goes nuts. It sends out all kinds of electrical activity that usually, frequently, no, I'd say almost always renders the patient unconscious eventually. The seizure we call, in medicine we call an event, we call it an ictus, I-C-T-U-S. And so when you have a seizure, that happens. Seizure lasts for a while, and then it goes away, and then you have what's called a postictal period. And during the postictal period, most people will have, if they have, for instance, a right-sided brain tumor, they'll have a left-sided paralysis that will gradually get better over time. There are many kinds of seizures, though. Some seizures people can have just sitting here, and you you think they might be acting a little funny, but you're not sure, and yeah, they're having a seizure. There are people who have one seizure every year or every 5 years. But then there are people who have 200, 300, 400 a day. And as you can imagine, if you're having that many seizures a day, you have a seizure, you're unconscious, you're out of control, there is no control. It comes back, and now you are postictal. And when you're postictal, you're not right. And then pretty soon you're going to have another one. There are people who are literally either seizing or postictal all day long. And those people, of course, have severe intellectual dysfunction, all those things all the things the brain does, you can imagine. And Dravet syndrome is one of those. It is definitely true that some patients with that type of seizure disorder will respond almost miraculously to cannabis. They don't need the THC, which is the drug that the part of the marijuana plant that causes hallucinations and the recreational effects that people seek. It is not that part that controls the seizures. When those people have better control of their seizures, their intellectual capacity does go up. It is definitely true that happens. Marijuana has been advocated for seizures, been used to treat seizures for many years. A very respected, one of the most respected neurology journals that we have published a report on that in the 40s. And so we've known that marijuana can help control seizures for many years. I think at this point in our oh, by the way, I was just Googling something this morning, and was it the Georgia legislature yesterday? The House passed a medical cannabis bill, 171 to 4, 171 to 4, I think. I think its time has come. I think that the medical uses for marijuana are absolute. They are happening. They are is indicated for a number of medical uses, and I think that we really need to give serious thought to improving it.
Thank you, Dr. Carlstrom. This time I'd like to turn it over to Frank Caligiuri, who is the